The emergency department has come a long way from the old days of the accident room. The emergency room today is the entry point into healthcare with anything but an elective admission. When we designed the Anderson ER, we designed it to be able to take care of almost any event.
We have 98 beds within the Anderson Emergency Center. We offer a full cadre of diagnostic tests. We're one of the first to have a cardiac catheterization lab within the department. We have our own observation unit, 2 CT scanners, 24-hour ultrasound, and now the MRI, which really allows us to get the definitive imaging test for our patients.
Our ER is one of the busiest emergency rooms in the United States. It's always in the top 10. The volume is extraordinary, well over 125,000 visits a year. And have an ER is well equipped with imaging as this is unusual. But to have an MRI in the ER is literally 1 to 2 institutions in the entire country. The MRI is important enough in medicine that you cannot continue to take care of patients acutely without the access to the MRI.
We're able to determine the definitive management plan for our patients. If they have a compressive lesion and they need the operating room, well, they don't need to go to an inpatient bed and wait for that test later in the day, only to learn that they needed the operating room. We're able to provide that to them sooner, just as we're able to prevent a hospital admission for a patient that needed an MRI for a transient ischemic attack by getting it earlier in the department and then sending them home.
It's the #1 technique to decide if a patient has a stroke, and hemorrhagic stroke, non-hemorrhagic, and needs to be treated. So it's very important for that. Trauma care, particularly in the spine, we had no way of seeing if the spine was injured after a motor vehicle accident, for example. We knew the bone was broken, but was the spine damaged? Did it need surgery or not? MR is the way to make that analysis.
And if in a pediatric patient or a pregnant patient, for example, whereas we may have chosen a CT scan, normally, potentially on a case-by-case basis, we would choose the MRI.
We have a wide bore or opening on the magnet, so it can tolerate patients who are more obese. Also, trauma patients frequently have a lot of tubes and lines going in them, and they need access to that. We've purchased a respirator that can be used in the magnetic field, something people don't traditionally think about.
We feel that our patients are safer because they're within our department, they're not out of our reach while they're getting the study obtained. And overall, I think it just adds a better sense of care because they're still within our care. They don't have to travel a great distance to get the study, and we're able to get the results faster and help it determine our disposition ultimately.
This magnet is dedicated completely to the ER. It's servicing the ER. It's available 24/7, 365 days a year to provide the best possible care to patients in the emergency room at Rhode Hospital.
This tool coming to the ED in collaboration with our excellent radiology colleagues really shows our commitment to providing the best possible care for the emergency department patients. We're able to do more than we ever have before and do it well.